The state leaders are saying that this delay will push back their efforts to vaccinate all Virginians in that first group, phase 1A, by a few weeks. But they do say that overall they are happy with how this first week of vaccinations have gone.
State Health Commissioner Dr. Norm Oliver says for the next few weeks, Virginia's shipments of COVID-19 vaccine will have fewer doses than initially planned, which will impact their year-end target.
Instead of the 480,000 that we thought we would get by the end of December, it's going to be more like 370,000.
Oliver says he's unaware of why, but other states have reported the same issue. Pfizer says it has no production issues and was waiting for shipping instructions. A Health and Human Services spokesperson, meanwhile, told CNN that states will still receive their full supplies, but delivery may be spread out over a longer period. Oliver says this will delay by a few weeks Virginia's efforts to vaccinate the first group of recipients.
It'll be sometime in January when we vaccinate all of that population.
That population is roughly 500,000 people. One portion, healthcare workers, started getting shots this week. Oliver says when Moderna's vaccine is approved, likely in the coming days, Virginia will get over 146,000 doses to reach even more. While he says the other part of that first group, long-term care residents, will be handled by a federal initiative starting the week of December 28th.
In the course of 4 weeks, the plan is for CVS and Walgreens to vaccinate all the residents of nursing homes and assisted living facilities.
Meanwhile, officials add they're awaiting federal guidance on who will be in the next group, but Governor Ralph Northam says it will likely be made up of essential workers.
People like our first responders, our food processors, our teachers, all of these individuals hopefully will be in that group.
And Northam says they are still hoping to have all Virginians vaccinated by midsummer of next year, but adds until that time, people need to continue to follow those social distancing guidelines like mask wearing, hand washing, and avoiding large crowds.